Depression is one of the mental conditions. It is a mood disorder with the signs and symptoms of extreme sadness or persistent sadness, and also comes with loss of interest in activities that you once enjoyed. There can also be issues with memory, or there is forgetfulness, and then there can also be difficulties in thinking or with thinking. Now, all this must be persistent for a period, either in 2 weeks. And then there are also issues with your pattern of eating and sleep. So your sleep and eating patterns are affected. So when you begin to experience this and it's persistent, then we can say one is depressed. So when we are looking at depression, we are looking at least having 3 or more of the signs and symptoms that I've mentioned earlier, and they must be persistent. And when they are persistent, then we can say one is depressed. Now, there's difference between sadness and depression. Sadness is normal feeling or grief that one may go through as due to a difficult situation or moment, and then it may not last for long. But when we are talking about depression, we are talking about sadness that is persistent with other signs and symptoms. As I mentioned earlier, there may be loss of interest in activities that one once enjoyed. There may be issue with the sleep and eating pattern. It means that sleepless nights may come in, and then in some people's situation, they either loss of appetite or overeat. So when this persists for a period, then we can say one is depressed. Now, who does depression affect? Depression can affect anyone. It can affect anyone. It can affect children, it can affect adults, teenagers. Almost everyone can be affected by depression. But there are some people that are predisposed more to depression than others. One, people that suffer neurodegenerative diseases like the Alzheimer's, the Parkinson's disease. Now, when we say neurodegenerative conditions, we are talking about the nerves. So when we talk about degeneration, we are talking about dying. So when the nerves or the makeup of the nerves in the human body begin to die, it means that those people are predisposed to conditions like the Alzheimer's disease, the Parkinson's disease. And people with those conditions are more predisposed to depression than someone who is not with those conditions. And then people who suffer stroke are more predisposed. People who have seizure or epilepsy are more predisposed. People who have cancer or chronic pains, they are more predisposed than people who are not suffering from any of those conditions. So people who have medical conditions that give them chronic pains, like maybe the arthritis, severe back pains, neck pain, waist pain, those people are predisposed to depression more than those without those pains. Now, how common is depression? Depression is very common. It's very common because when you take a population, about 7 to 10% of that population suffer from depression. So it means that when you take maybe 100 people, about 7 to 10 of them may suffer depression. Now, what are some of the causes of depression? The actual cause of depression is not known, but there are factors that contribute to depression. And one of these factors is the brain chemistry. Now, when we talk about the brain chemistry, we are talking about an imbalance in the hormones of the body. So hormones such as the serotonin, the dopamine, they can contribute to the development of depression. When their levels are altered, they can contribute to depression. Then we can talk about genetic makeup. So the genetic makeup of an individual, so it means that if maybe your parents, father, mother, are predisposed or have depression, it means that you are 3 times predisposed to depression than someone without that condition. You are 3 times predisposed to it than someone without that condition. Then we can talk about stressful life events. Stressful life events like maybe loss of loved one, divorce, traumas, maybe isolation and lack of support. They can also be trigger factors of depression. Then some medical conditions, as I earlier spoke about, chronic conditions like diabetes, hypertension, cancer, and the rest, they can contribute to depression. Then there are some form of medications which make one depressed. These medications, their side effects will make one to be more depressed. So anytime you are taking a medication, be very careful the kind of medication you are taking. And then people that abuse drugs and alcohol are also more predisposed to depression. Now, how do you manage depression? In the management of depression, when it moves from moderate to severe, then it means that the person must visit the hospital. There are levels of depression, from mild, moderate to severe. So in the moderate and severity, one must visit the hospital. And then apart from going to the hospital, there are other things one must do. You must always engage in regular exercise. You must enjoy quality sleep. Your sleep, at least 6 to 8 hours sleep, is very important. You must eat a healthy diet or well-balanced diet. You must avoid alcohol, avoid drug abuse, then avoid medication that will make you more depressed, and also avoid caffeine or caffeinated drinks. They can also make you more depressed. Then you must spend more times with your loved ones. You must engage with nature, and then you must also do some form of meditations, some form of yoga practice. They all help in management of depression. Now, how do you prevent depression? For you to prevent depression, it means that one, you must be able to develop coping mechanism. You must understand that life is such a way that situations may come, hard times may come, difficult moments may come. But in all this, you must be able to develop a coping mechanism to be able to cope with the situation. You don't dwell too much in the situation. And then whenever you are going through challenge and there's the need to cry out within a short period and come out from that situation. When you begin to continue to dwell in that situation, it may lead to depression, which may be persistent. So enjoy good sleep, a healthy diet, exercise, practice self-care. This will help to prevent depression. If you come across this video, I will play it with you to share so that others will also benefit from this video. Don't be selfish, don't keep it to yourself. And when you experience any of the signs and symptoms that I mentioned earlier that are persistent, visit the hospital. Earlier treatment leads to early recovery. So visit the hospital, go for treatment, be able to connect with nature, connect with your maker, connect with your family and friends. That will help to overcome depression. Share this video and follow us. Follow us so that when we teach more on mental health and its related issues, you also benefit.